Hello YouTube. Today we will study necrotizing enterocolitis. It is the most common and devastating surgical emergency in neonates. Okay. Basically, the etiopathogenesis is there are several causes. We'll talk about three main causes. Okay. The first one being prematurity. The second one being top feeds without breast milk. Third one being other factors. So because of prematurity or top feeds without breast milk, there will be inflammatory necrosis. How? The baby was immature, he had an immature GI tract, so there was inflammation leading to necrosis. Or the baby had top feeds without breast milk, which would colonize pathogenic bacteria, then there would be inflammatory necrosis. Both of these is due to infection. Now, the other causes could be asphyxia or maternal cocaine use, which led to vasoconstriction of splanchnic circulation, leading to necrosis. Okay, so the first two are because of infection due to a bacteria and then inflammation. The next one is because of vasoconstriction, leading to necrosis. Now, we will study staging. The staging is modified Bell staging. So there are three stages: stage 1, stage 2, stage 3. Stage 1 is suspect NEC, stage 2 is definite NEC, stage 3 is complicated NEC. So imagine this is the bowel, this is the bowel wall, and this is the surrounding peritoneum. Okay. So in stage 1, the bacteria is in the epithelium or lumen of intestine. Okay. So there will be non-specific features like vomiting, abdominal distension. Okay. Now, if the bacteria breaks the epithelium and is in the wall of intestine, we call it stage 2. So, because there would be air in the intestinal wall, it is called pneumatosis intestinalis. Pneumatosis intestinalis. Okay. Now, the bacteria enters the peritoneum. Okay. Along with air, obviously, leading to pneumoperitoneum and peritonitis. So, if you would want to appreciate, this is stage 1. In the wall would be stage 2, outside would be stage 3. Okay. Now, the features. Stage 1 is further classified as 1A, 1B, stage 2, 2A, 2B, stage 3, 3A, 3B. 1A has occult blood in stools, 1B has gross blood in stools. Imaging would be normal. Okay, blood in stools, stage 1. Occult 1A, gross 1B. Coming to stage 2. If there are absent bowel sounds, it is stage 2. Okay, in stage 2A, there would be absent bowel sounds and pneumatosis intestinalis, which is the characteristic feature of NEC. In stage 2B, there would be absent bowel sounds plus abdominal wall edema. Basically, there is air in the intestinal wall. It enters the venous drainage system, superior mesenteric vein, and the portal vein. So there will be pneumatosis portalis. Stage 2A, pneumatosis intestinalis. Stage 2B, pneumatosis portalis, because it entered the venous drainage and ultimately the portal vein. Okay, portalis. Oh my god, my hair. Now, stage 3A is induration, redness, tenderness of abdominal wall. Okay. And 3B would be intestinal perforation. There is no specific imaging in 3A, but 3B has pneumatosis peritoneum. If you could appreciate this picture, there is air under the diaphragm, which is stage 3B. Now, how would you manage NEC? First, you would obviously have to make a diagnosis. So, after stage 2B, you would have a triad of thrombocytopenia, metabolic acidosis, and hyponatremia. There are less platelets, there is less sodium, and there is less alkali. metabolic acidosis, hyponatremia, thrombocytopenia. Got it? But this triad does not have a relevance in diagnosis. You would do imaging and you would appreciate an EC. Okay. Until stage 3A, you would do medical management, which is nil per oral NPO, nil per oral, TPN, total parenteral nutrition, and IV antibiotics. For gram positive, gram negative, and anaerobic bacteria, penicillin, aminoglycoside, metronidazole. Got it. IV. Antibiotics are IV. For stage 1A, it is for 3 days. For stage 1B, it is for 7 to 10 days. For stage 2 and 3A, we have 14 days. For stage 3B, the baby would either be hemodynamically unstable or hemodynamically stable. So if the baby is unstable, we would first do a primary peritoneal drainage, which is an emergency procedure. Okay, and then the baby would stabilize. Then we would do a laparotomy, in which we would do resection and anastomosis. If untreated, it is the most common cause of neonatal mortality. Got it? Bye, YouTube.